Late Night Health continues. I'm Mark Alyn. In the news, we hear a lot about our medical records. I believe it is now a federal requirement that medical records are stored electronically. We'll find out more about that and find out why it's a good idea to have electronic medical records. Our guest is Mark McKinney. He is the CEO of HIXNY. It's a nonprofit electronic health information exchange. It serves 28 counties. I misread that. It serves 28 counties that make up eastern New York, and they are based not far from our friend Robert Clancy in Albany, New York. HIXNY drives better care and lower costs with one-point access to every person's healthcare records. It's faster, and it helps provide better care. Mark, welcome to Late Night Health. Thanks for spelling your name correctly. And he spells it with a K. Let's start by finding out about medical records. Am I correct that it is a federal mandate that our medical records need to be stored electronically?
Yeah, good. Thank you, Mark, first for having me here today, and it's my pleasure. So, medical records or medical information is now much more commonly stored electronically. It's not necessarily a federal mandate. It is a requirement for certain participation in certain healthcare programs. There are providers who still do use paper for some records, and that's largely because they may not participate with some of those programs like Medicare and Medicaid. So, but for those providers, which is most everybody who does, they do use electronic medical records, and there are programs such as Meaningful Use that really encourages the adoption and use of electronic records.
Is it better for patients, for me as the medical consumer, to have my records stored electronically rather than in a folder in somebody's storeroom?
Absolutely. It gives the ability for the information to be portable and to be shared from one provider to another much more easily. It allows for some artificial intelligence services. We talk about AI as a really complex topic, but the reality is that a lot of what computers do, in terms of being able to validate certain things like drug interactions when prescribing medications, or just being able to record history and not have it get lost in volumes of paper, make it searchable, are certainly things that benefit the patient.
So one thing that you just said struck me. If I go to Dr. A and he gives me a prescription, and then I go to Dr. B who gives me a prescription for something else, the AI part of the medical records could say, hey, you can't take them both at the same time because your right foot might fall off.
That's right. So it gives you the ability to know what the other doctors are doing and make sure that you get a much more accurate treatment plan. It certainly helps with patient safety from that standpoint. There are various checks in the system, but most importantly, it also helps with service duplication. So if you go to Dr. A or you go to Dr. B and then Dr. A has already prescribed a specific medication, Dr. B may not, prescribe some other medication which is duplicative of that one, or might order a lab test or something else which has already been done, or a radiology exam that's already been done. With
the opioid epidemic, what some people have done is they go to Dr. A and they say, my knee hurts really badly, I need something. And they get a prescription for an opioid. And then they go to Dr. B, C, D, E, F, all the way to Z, asking for the same drug. And this could stop that, could it not?
It certainly can help with that in a lot of different ways, because we're able to see, how patients' behavior in terms of how they seek health care by bringing all the records together in one place. So we could see, for example, if an individual patient has been, doctor shopping or has been, using multiple emergency rooms. It's not unfortunately, with the opioid epidemic, we do see occasional situations where patients will show up in multiple emergency rooms in the same day. But what it does is it gives the ability for a physician to be able to see, right? So if I'm Dr. B and a patient shows up in my office or my emergency room and says, I have a problem with my knee and I need some type of pain medication, Dr. B can actually see if Dr. A has already prescribed it. And that's really one of the big advantages of bringing all this information together in one place is that you decentralize the information down to the individual provider so that they can make judgments about what to prescribe or what tests or services to order for a patient.
I don't know the answer to this, and which is why I'm asking. If I go to Dr. A and I use my insurance, but if I go to Dr. B, C, etc., and I say, well, I'm going to pay cash, and I have no medical, I don't have insurance. That would be a way for somebody who wants more drugs to get them, I would assume. Or do you need to show ID to get medical treatment?
Well, in each of the cases, the physician should know who they're treating. But as long as they prescribe the order for the patient, then you should be able to see that as you go to Dr. B, C, D, and E. Should be able to see what all the previous physicians have seen, regardless of how they've paid for that medication. And in some cases, we have physicians who require that a patient signs what's called affirmative consent to allow them to view and access their records to ensure that they haven't sought these medications elsewhere previously.
Let's talk about HIXNY. It's a nonprofit organization. How did it start and why?
HIXNY started about 20 years ago as a joint venture between the New York State Health Plan Association and the Iroquois Health Alliance, who were trying to work together to find common ground around HIPAA, which first kind of came out about that time in 1999. And so in that process, they really determined that the ability to be able to transmit information, which wasn't really that electronic back then, in a much easier way, primarily around how do we move health insurance claims between providers was really the goal at the time. And that really then grew into, well, how do we get this information to the hospitals and to the health plans and to all the providers in the community as a way to improve care and lower cost?
And your background, what is that? Was it as a CEO someplace else, or have you always been involved in the healthcare industry?
I've held a number of different positions along the way. This is my first time as CEO, but I've done had a number of different roles in healthcare. I've worked for the pharmaceutical benefit management industry. I've developed different types of analytical software for healthcare research, as well as I've served as a medical economist in my past. So I've kind of seen a lot of healthcare from a lot of different perspectives, and so I kind of know how all the pieces fit together.
Many people are saying that our healthcare system in the U.S. is broken. Can companies such as HIXNY help alleviate that brokenness? Is that a word?
I believe it is a word, and I would say that that yes, I think we can. I think there's certain parts of it that we can't fix, right? But one of the things that people, when they talk about the healthcare system being broken, is about the nature of the fact that patients get fragmented care, that information exists in multiple silos or data warehouses or databases in different places. And an organization like HIXNY can help bring all of that information together so that in your example of patients A, B, C, and D, that each of the providers on that patient's care team have a complete understanding of what's happening with the patient and can provide really comprehensive strategic care for the patient that is appropriate given their condition. So, that we are not necessarily duplicating tests or services that have already been done, and we're really trying to understand what is at the root cause of each individual patient's conditions and making the right decisions for them.
There are a number of electronic health information exchanges, or HIEs, throughout the country. And because we are coast to coast here at Late Night Health, are these other companies, do they work together? I mean, you're in New York State, but if there's an HIE in, say, Alabama or Ohio, can you guys function together?
Yeah, so there are, in fact, a lot of HIEs around the country. Typically, HIEs will generally serve a regional area. They're often called regional health information organizations. And they'll serve a kind of a defined service population. That service population could be large, like a state, or it could be smaller, like a subset of a state. So in the case of New York is divided into multiple organizations like HICSNY, who each work together to form a network across the entire state. So while we serve 28 counties in New York, there's 62 counties in New York, and so there are other organizations like us who serve the remaining counties. And so, but there's overarching one network that HICSNY plugs into that serves the entire state. So whether a patient goes for care in New York City or in Albany or Buffalo, that provider, wherever they're located, can see that information there. And then the other HIEs around the country, many of them belong to an organization called SHEIC, which is a Strategic Health Information Exchange and conference. And so they together have a network where they can share information on a much more national basis. So while most healthcare is local and patients have the ability really to choose where they want to get care, most of the time the care they receive is generally around where they live, but there are times where they travel outside of those areas. And so using the various networks, they have the ability to share this information.
So if I'm traveling to New York from California, there is a possibility that my medical records could be shared with a doctor in New York by my doctor here in California if I needed treatment.
There are various ways that can happen.
Wow. We're going to take some time out and come back. HICSNY recently supported a public opinion poll of 1,000 residents in its territory of New York, and we're going to find out why you did the research and what the results were from that, because we keep hearing about people saying, I don't want my medical records shared, they're private, they shouldn't be shared. We'll find out more about that as we continue. I'm Mark Alyn. We'll have a link to HICSNY if you want information about HICSNY, and maybe even a picture of Mark on our website, which is latenighthealth.com, latenighthealth.com. I'm Mark Alyn, along with the insane Daryl Wayne. Don't go away. There's more coming up as we continue here on Late Night Health. Recently, I met Jacqueline from Bright here in Los Angeles. She gave me a hearing exam and then showed me how to hear again with the new Signia Pure Series hearing aids, and she can give you your life back too. I hear birds chirping, birds cooing, and even my wife. They easily connect to my smartphone. The Signia hearing aids are amazing, and with the charge and go, I don't have to fiddle with batteries and hear all day long. Not hearing is frustrating for you and your family. I know you don't have a problem, but trust me, call Bright Here now for a free hearing exam, a $125 value, yours free, just for making an appointment now. There are offices throughout the Los Angeles area. Call Bright Here now at 323-424-7100. That's 323-424-7100 for a free hearing exam. There's no obligation. Call now, 323-424-7100, or visit them on the web at brighthere.com. There's a lot of talk all over the internet about the remarkable benefits of Carbon-60, and baby boomers are especially excited about it. Greska's Carbon-60 is the premium Carbon-60, developed by an aerospace and NASA scientist. 95% of Greska's customers report positive results from this Nobel Prize-winning technology in just 4 days. Imagine more energy, better health, and more vitality. It's very bioavailable to quickly mend toxin-crippled cells. This is a super powerful antioxidant. Bob Greska is so confident that you'll love his Carbon-60, he wants to send you a bottle at 50% off the regular price to see how life-changing this will be for you. Call 720-600-6040. That's 720-600-6040. Visit c-60.com to learn more. Call 720-600-6040 now or visit c-60.com.